I'm Shayna, and today we have Miss Mask, my patient today. Um, Today we're going to do a full head-to-toe assessment on her. Um, okay, Miss Mask, are you ready?
Yes, ma'am.
Okay, if at any point of this assessment that you feel any discomfort, just let me know. I'm going to first start off by washing my hands, and I'm going to come in. I'm going to first start off with your head, and I'm going to start off with your scalp. And what I'm looking for is lesions, any hair loss or anything like that, any nodules in your head once I start feeling into your head, okay? I'm going to look into the scalp right now, make sure I see if it's looking for cleanliness and, like I say, any hair loss, anything like that. And none of that is noted. I'm going to palpate in your head. Do you feel any pain or discomfort when I'm doing that? Okay, Mrs. Nash. I'm going to look around the edges of your head, make sure there's no lesions or scars or anything there. Okay, now Miss Mask, I'm gonna check your ear area and turn that way for me. Okay, and I'm going to palpate your pinnae. Just let me know if you have any pain when I'm doing that. Do you feel any pain? Okay, do you feel any pain when I'm going down, pulling your ear down? And I will pull her ear down and look inside of her ear with my light if I had one. We were in a hospital setting or a doctor's office setting. And I'm going to push your teeth in. Do you feel any pain there?
No.
Okay, you turn back around for me. Okay, Miss Mask, we're going to now assess your face, and her eyes and everything looks symmetrical. Her face is symmetrical as well. And I'm going to check your eyes, and I'm checking your conjunctiva, checking to see if there's any drainage, purulent drainage noted in there. And I'm going to do that by pulling your eyes down. Everything looks good there. I'm going to check for perla in her eyesight. I'll take my pen light and I would bring it in and out and make sure that her eyes are round and reactive to light. Um, I'm going to also check your eyelashes, make sure there's no debris or anything falling into your eyes. That's what they're for, to protect it from happening. Um, I'm going to now palpate your sinuses in your face, and just let me know if you feel any pain at that time, okay? Okay, I'm going to start up here. Any pain there?
No.
Okay. Miss Mass, we're now going to look inside of your nostrils. I will take my pen light and look inside of each nostril, and I'm making sure there's no foreign bodies, no purulent drainage in there. Make sure that her nerves are not inflamed or too red. Make sure that they're moist and not too dry. Okay, Miss Max, we're now going to assess your mouth area, and I will assess the outside first, and I'm checking for lesions, any discoloration around her mouth or her lips or anything to that nature. And I see that everything looks normal there, and I'm going to get you to open up your mouth for me. And I'll take my pen light, say ah, ah, and I'm checking to see. I see the uvula. Make sure that see if her tonsils are there or if they're not. And I will also check to see if she have any sores or anything in her mouth. And I will check her mucosa to make sure that it's moist in the inside of there as well. And now, Miss Mask, I'm going to check your lymph nodes in your neck area behind your head, okay? Let me know if you feel any pain as I palpate those, okay? Let me
Yes,
touch. All right, we're going to start with her occipital lymph node, and we're going to move our way down. And then I'm going to check her subclavicular lymph node. And do you feel any pain as I did that?
no, ma'am.
Okay, we're now going to I'm going to check your sub maxillary lymph node and your mandible. No pain there?
No.
Okay, we're now going to, while I'm down there, I'm going to check your carotid. And that'll be noted on each side of your neck, and I'll check one side at a time. And I'm going to listen to it, and when I listen to it, I want you to hold your breath, okay?
Okay.
Hold your breath. And do the same for this side. And when I'm listening for to if I hear any bruits or anything like that. If bruits are noted, then that's a abnormality, and we'll have to report that to your physician. Okay. I'm now going to Okay, I'm now going to get you to we're going to do an assessment on your range of motion on your upper body, and also I'm going to check your hearing, and I will do the Webster test and the Ryan test. If I had the little tool, I would sit it up here and I would ask you, do you hear the sound bilateral and equally in both ears? And if you had any, I'm checking the air conduction. And if you had any difficulty hearing, I would do the Webster test, and I would do this ear first, and then I would do this ear after. Um, Now I'm going to get you to raise your shoulders up like this for me, down, and push up with down. Okay, that was pretty good. I'm gonna get you to touch one ear to your shoulder. Correct, and do the other ear. Okay, good. I'm going to get you to do your head like this, down, and circular motion like this. Okay, that's pretty good. Do you feel any pain doing that? Okay. I'm now going to get you to push your face to my hand, and again with this hand. Okay, I'm going to get you to look behind me at an object, at the wall, and then I'm going to get you to look at me now. And I'm going to get you to follow my finger in each direction that it goes without moving your neck, just your eyes, okay? If I go there. Okay, pretty good. I'm seeing if your eyes are symmetrical and following my hand. I'm going to get you to stand up for me. Okay, I'm going to get you to, I'm going to do a Rumberg test on you. I'm going to get you to close your eyes. Okay, you didn't lose balance or anything. You can have a seat. Okay, Miss Mack, I'm going to check the grips in your hand. I'm going to get you to push towards my hand. I'm going to get you to pull. Okay, and while I'm here, I'm going to check your nails, make sure that they're clean, make sure that I don't see any lesions or nodules or anything on her hands. Everything looks up to par with that. While I'm down here, I'm going to check your radial pulses, and I will also check her brachial pulses. Okay, they're strong and equal bilaterally. And I'm going to check your capillary refills. And grit skin is times 3, less than 3 seconds, um, which is good. That's checking to see if your blood flow is normal. Okay, I'm going to check your skin turgor, and that's going to tell me if you're dehydrated, or if you're hydrated or dehydrated, and that was normal as well. Um, okay, Miss Mask, I'm going to now get you to, while we're up here, I'm going to get you to do some range of motion for me. Get you to move your arms outward for me, then down. Can you do this? Then go back. Okay, that's pretty good. Okay, now Miss Mask, I'm going to get you to lie down for me. Scoot down for me just a little bit. Okay. Um, um, Now I'm going to assess your abdomen area, and by doing that, I would, in the clinical setting, I would have her shirt raised, but since we're on video, I'm going to keep her shirt down for privacy purposes. In here, Miss Mask, I'm going to check the 4 quadrants of your abdomen, and I'm going to palpate your abdomen, which means that I'm going to feel your abdomen, and at any point you feel any discomfort, let me know, okay? I'm going to start by doing a light palpation. And then I'll do a deep palpation with both hands. Okay, Miss Mask, I'm going to now listen to the 4 quadrants with my stethoscope, and I'm checking for bowel sounds in each quadrant. Okay. I'm going to do the right upper quadrant first. Right lower quadrant. Left lower quadrant. Left upper quadrant. And I'm listening for hyper or hypo um, vowel sounds, and they were within normal limits. It wasn't hyper or hypo. Um, I'm now going to palpate her spleen. Okay, pain there. And I'm now going to palpate your liver. Any pain there? Okay, and I'm going to percuss her abdomen. And I'll do so by tapping my fingertips to listen to the sound. The aorta, the iliac, the femoral. And I do the same on this side as well. And I'm going to palpate your spleen. I'm going to percuss your spleen, I'm sorry. Okay, now I'm going to come over here and percuss on your liver. Okay. I'm now going to listen to the vascular sounds with the bell part of my stethoscope, okay? And there I'm listening to see if I hear any bruits. Make sure I don't hear any bruits, okay? Okay, everything sounds good. Okay, I'm now going to palpate her lymph nodes in her abdomen. And we'll start off by the aorta is up here, the iliac, and the femoral. And of course, it'll be further down if I was able to have her, undressed or whatnot. We're now going to check your I'm sorry. We're now going to check. Oh, I'm going to get you to raise your leg up for me. Do you feel any pain in your femoral area? No pain there? Okay. I'm now going to check your, let's see. Oh, I'm gonna now check your lower extremity, and I'm going to first start off by assessing your skin. And I will do that by looking to make sure that there's no discoloration to your legs or your feet, and I'm going to also make sure that the hair is bilaterally growing on each leg, and I'll also make sure that there's no discoloration to your toes or anything to that nature. And I'm going to check your pulses on your lower extremity as well, and we'll do so by starting off with the popliteal, which is underneath the knee area. And then I'll move my way down to the anterior left dorsal no, the anterior pulse here, and then I'll move down to the pedal pulse, which is on the lower part of the foot area. If you could bring your foot up for me just a little, no, you could bend your leg. And we'll check the pedal pulse here. Okay. And make sure that they're equal bilaterally. I would check them both at the same time. All right, Miss Mask, to check hip placement, I'm going to get you to bring your leg out and bring it back for me. Any discomfort when doing that? I'm going to do the chin to chest method. I'm sorry, your knee to your chest method. Can you bring your knee up, bend it, and bring it back? Any pain there? Okay, there's no pain noted there. That's great. Okay, I'm going to also check the cap refill in your toes. Let's see. Your toes are pretty cold. Toes were pretty cold, but your cat refill was within normal limits. I'm going to also um have you to sit up for me. Turn around. We're gonna turn this way. In here, I'm going to listen to your lungs, and I'm going while I'm back here. I'm going to also assess her kidneys. Okay.
Yes.
All right. I'm going to start off by listening to your lungs, then I'm going to get you to deep breathe in, out, in, out, in, out, in, out. Again, in, out. Okay. Okay. Um, I'm going to palpate your kidneys, and I'm checking to see if you have any pain or anything noted in your kidneys, and I'm going to do that by doing the fist to uh, flank method, and we're going to do that by doing this. Do you feel any pain?
No.
I'm going to percuss on your kidneys. Any pain noted when I do that?
No.
Okay, you're going to turn around for me. Also, I'm going to listen to the front of her chest as well. I didn't do that when I had her sitting up earlier, but I'm now going to listen. Deep breathe for me. Okay. And I'm going to go under. Okay. All right, Miss Mask. I'm now going to get you to stand up for me. I'm going to get you to stand in front of me, and we're now going to I'm going to check and see. Okay, that's good. I'm going to get you to turn around. I'm sorry. I'm going to check your spine. Okay, make sure that it's symmetrical, that we don't see any curves in your spine as you bend down forward. Okay, Miss Madison, I'm going to check your spine. Everything looks good. Can you touch your toes for me? Okay, any pain there? Okay, you can raise up. That's pretty good. Turn this way for me. And can you lift above your head? Can you go down? Can you lift back? Okay, turn around for me, and I'm going to get you to grab my hands backwards. Can you pull them? Okay, pretty good. Turn back around for me. I'm going to get you to lay down, and I forgot to do one part on her feet. I'm going to check the strength in your feet. Can you raise your toes back? No, just your toes. Raise your toes back for me. Okay. Can you does that hurt? Any pain there?
No.
Okay. Push your foot against my hand. Okay, and push them forward. Okay. Pretty good. Strength is equal bilaterally in both feet. Um, okay, Ms. Mask, I'm going to now check. Okay, I'm going to now get you to sit back up for me. You can turn your legs around. Okay, Ms. Mask, I think this will conclude our assessment. Oh, and when I check inside of Miss Mask's ears, I will be checking the cerumen around her eardrum, make sure that it's silvery in color, that is minimum cerumen noted if possible, that is not pink, any purulent drainage coming out of her ears or in her eardrum is not perforated. When I'm checking the lymph nodes in her neck, I'm making sure that they aren't swollen, which could be signs of infection. Making sure that there was no bruits or anything noted in her carotid when listening to it. There would be, she would have to seek medical attention from a doctor. I'll make sure when I look into her nostrils and her mouth area, make sure there was no lesions, no drainage, no sores or anything noted there. When I listened to her pulses, they were brisk and equal bilaterally. Um, her strength in her legs and her arms and her hands were equal bilaterally as well. Um, this will conclude our assessment. And Miss Mass, thank you. And if you have any questions, feel free to ask me, okay?
Yes, sir.
All right, thanks.